There are two categories here. The first one is the people who have no symptoms whatsoever, but they do have the appearance, okay? Because there's a certain situation where there are people who come to me and they say, well, we don't have any symptoms, but they look ugly. And I look there and I say to myself, well, they should have symptoms, because obviously there's a lot of inflammation going around and so on. But the problem is that they have lived with this for so long, it has become normal. Now, those very people, when I do treat them, they usually come back and say, oh my God, you know, afterwards, they feel so good now. And I don't have any more pain. I don't have any more swelling. And of course, I hadn't realized I had those. So basically, vein disease it's not a perfect division, but it is classified into 6 different categories, which are referred to as C. It's called the SEEP classification. Now, it's obviously, you know, there's not the time or place for me to explain all that, but suffice it to say that there are 6 stages to that. Number 1, well, it starts with 0. 0 when you actually see nothing, but people could be symptomatic. I do see those people from time to time where you look on the outside, you don't see anything, but they do complain of heaviness in the legs and cramps and charley horses and ache at the end of the day. And when I do the ultrasound on them, I do find that inside there are sort of significant reflux in those veins. And therefore they would warrant treatment. And of course, insurance will pay for them because they are symptomatic. Now, they would be ironically classified as 0 because you don't see anything on the outside. So you go to number 1. Number 1 is when you actually see spider veins. Again, spider veins could be the tip of the iceberg. Disease inside. They could be asymptomatic completely, except for the appearance of those spider veins, which are, of course, of concern mainly to the youngish age group. Now, number 2 is when you have some varicose veins jutting on the surface, but without any swelling of the legs, without any skin changes. Then number 3 is when you start getting swelling. You know, at the end of the day, people will have some ankle swelling, and sometimes that does mask the veins, the bulgy veins, and ironically, people think they don't have as bad disease when they do, simply because the veins have been masked by the swelling. Then you go to a much more serious category, which is number 4, which comes in 2 divisions, A and B. Now, when you start getting a lot of skin changes, and the skin actually literally becomes leathery, you know, like leather, literally, like shoe leather to feel. And sometimes when you drive a needle into it, it doesn't even go into it. It's that hard. And when I put the ultrasound on it, you can hardly see the tissues with the ultrasound. Why? Because it has become so compact, literally, even the fat tissue. And then you go to grade 5, and you know, 5 is usually there's a lot of scarring, and number 6 there's usually a lot of mischief. The most important is ulceration. So this is the way it happens. And when you reach number 6, which is ulceration, there's usually all of the above. There is usually swelling, there's skin changes, and there is a lot of mischief there, a lot of increased pressure in those veins to cause all those symptoms.